This is the Office of the Chief Dental Service AFP, and this is our Revalida presentation for the institutionalization stage. Outline of our presentation includes our commitment to transformation, breakthrough goals results, functional technical working group, consistent communication, link to budget, monitoring and reporting mechanisms, commitment of leadership, cascading to lower units, link to incentives, rewards and recognition, best practices identification and sharing, and plans on moving forward. Commitment to transformation. For more than 6 decades, the AFP Dental Service has been the AFP's partner in keeping the overall wellness of our troops. From being a component unit of medical service, it metamorphosed into an independent dental service, capable of delivering optimum oral health care to our troops, and creating beautiful smiles for every soldier, making them fit to serve, one smile at a time. Our mission is to assist the Chief of Staff, AFP, in the formulation of policies, planning, coordination and supervision of all matters pertaining to the AFP Dental Service, with a vision centered on increasing the number of fit-to-serve AFP personnel, and increasing capability of dental units, in order to preserve the fighting strength of the AFP, which is contributory in achieving the focused perspective of AFP Scorecard 2018. To significantly contribute in attaining a credible defense posture, that in addition, largely contributes to the AFP's pursuit towards becoming a world-class armed forces, a source of national pride by 2028. For our AFP trip conferrals, we were conferred with the initiation stage on April 27, 2015, conferred with the compliance stage on December 2016, and conferred with the proficiency stage last October 2019, with the Gold Governance Trailblazer certification, after 6 months of continued good governance and having a command philosophy of one team, one goal, for an excellent and professional AFP dental service. We continued our journey as we submitted our documentary requirements on May 28, 2020, presented our breakthrough goals on July 14, 2020, followed by on-site audit on September 10, 2020, and on November 26, 2020, the Chief of Staff AFP, General Gilbert Gapai Philippine Army, awarded the Office of the Chief Dental Service, its conferment with institutionalized status, and the Gold Trailblazer Award, for garnering a total of 94.53%. The OTCDS underwent the tough process of scorecard development. This paved the way to the current OTCDS strategy map. This outlines the long-term plans of the office, encapsulated in 14 strategic objectives, 5 in the capacity and resources. To institutionalize efficient financial management of resources. Develop responsive organization that ably performs mandate. Professionalize personnel. Strengthen effective planning, programming and management of logistics. And establish an accurate database. 4 in the capability perspective. Develop TOE of dental units responsive to the supported unit's mission. Develop competent personnel responsive to the major service requirements. Achieve R2 equipment readiness condition of all dental facilities to sustain mission accomplishment. And ensure that AFP dental facilities conform with the established building/clinic standards. 4 in the core approach perspective. Determine the effectiveness of the implementation of programs. Establish standards responsive to the current organizational setup of the dental service. Establish comprehensive capability assessment in relation to METL. And achieve purposive and efficient delivery of dental service to clients. All of which ultimately contributing to the achievement of the focus perspective. To have fit-to-serve AFP personnel. Which means having Class 4 classification, no treatment needed. Dentally fit personnel. And mission-capable AFP dental service units, in support to the achievement of combat readiness of our troops. Its attainment is being gauged and tracked with the 23 performance measures. At present, these objectives were translated into tangible and concrete actions, through the implementation of 92 OTCDS projects, activities and programs. As shown is our performance scorecard. Out of 23 performance measures, we've already reached our targets on 15 performance measures, wherein 7 out of 8 remaining performance measures is already in more than 50% accomplishments. Breakthrough goals result. The OTCDS attempt for transformation is dependent on 3 identified breakthrough goals. We believe that these breakthrough goals, when achieved, will have a great impact on our mission accomplishment. For focus perspective, We have elected the strategic objective number 14, which is our vision and the only strategic objective under focus perspective. It can be measured through increased number of dentally fit personnel. Our target for calendar year 2020 is 106,504. We have attained 82,863 dentally fit military personnel as of second quarter of 2020. Our challenge was aggravated by the event of the global pandemic of COVID-19. This office managed to craft guidelines regarding the new normal protocols in AFP dental treatment facilities, approved and released as Letter Directive Number 30 dated June 8, 2020, and an information video for patients and dental personnel. Allow us to show you this information video. The new normal procedures in seeking dental service, in AFP dental treatment facilities, upon lifting of enhanced community quarantine, to avoid the spread of COVID-19. Brief all dental personnel, dental officers, enlisted personnel, civilian dentists, and civilian human resources, on the new infection control protocol. DTFs are required to have an official email account, or a social media account, to facilitate communication between the DTF and its patients. Info videos and infographics shall be posted in this account. Aside from the AFP Dental Service Facebook page, which shall provide guides for patients. Require all dental personnel to have flu and pneumococcal vaccine. Conduct inventory and procurement of personal protective equipment supplies, as needed. Ensure dental supplies and materials are sufficient, as well as PPE for dental treatment facilities. Essential PPE are the following. Dental personnel, with fever, cough, or colds, must not report for work. Place supplies and instruments outside the operatory. Anything that is brought inside is considered contaminated. Both HEPA filter unit and extraoral vacuum system are highly recommended. Number of filter units will depend on the floor area of the DTFs and floor area of treatment room. It is a requirement to print and place signage on entry doors for necessary reminders. Physical arrangement in the reception area should allow social distancing of at least 2 meters or 6 feet. Remove electric fans and other appliances that can propel droplet nuclei around. All DTF entrances are required to have a shoe bath of 1 part hypochlorite solution to 10 parts water placed on a tray with rug. While inside the DTFs, patients should be discouraged from touching the office phone, desks, office pen, or other items if possible. Telephone triage all patients in need of dental care, and assess the patient's dental condition, to determine whether the patient needs to be appointed in the dental clinic, by using teledentistry, which includes teleconsultation and telemedication, as an alternative to in-office care. Use risk management guide questions. In doing phone screening, dental officer or dentist should ask the patient questions if there is pain, severe infection, swelling, or trauma. If possible, request to send digital photos, through mobile phones or computer, at DTF's official email account, or social networking account, private message function. It is practical to postpone elective procedures. These can be scheduled for treatment, after all the emergency cases have been addressed. If pain, infection, oral maxillofacial conditions, or trauma is present, urgent procedure must be done, with detailed home care instruction, and any appropriate medication. If emergency dental treatment is necessary, make appointments or schedules with dental patients, for their treatment in dental treatment facilities, considering necessary factors. Patients will be assessed, through dental triage, in the assigned areas in the DTFs. Prior entry to DTF, patient must step on the shoe bath to disinfect their footwear and disinfect their hands with alcohol. Duty NCO will conduct thermal scan to patient and log the name, unit and temperature at DTF's admission section. Temperature scan of 37.3 Celsius and above will mean postponement of dental treatment and referral to medical triage, while those with normal readings shall fill in and sign patient history and health status declaration form. If there is no circumstance that the patient is a probable suspect as COVID-19 patient, then they shall wait for their turn for treatment. Ensure that treatment rooms were disinfected, and both dental officer or civilian dentist and dental assistant who will treat the patient shall wash their hands and wear proper PPE. Adherence to proper donning of PPE, the sequence will be as follows. Perform hand hygiene or washing. Booties or shoe cover. Put on gown. Put on mask or respirator. Put on eye protection. Put on head cap. Put on gloves. Put plastic barriers on dental chair and dental equipment. Use mouth rinse with 1% hydrogen peroxide or 0.2 povidone iodine solution. Prioritize minimally invasive restorative techniques with the use of hand instruments like sharp spoon excavators, hand scalers, chemomechanical removal of caries, or micromotor. Use four-handed dentistry, and if possible, use high evacuation suction to minimize droplet spatter and aerosols. Use of rubber dam during dental treatment is a must. Sterilize all instruments used during dental treatment. Careful removal of plastic barriers on dental chair and dental equipment. Surface disinfection of the treatment room. Using sodium hypochlorite solution, 70% alcohol, and UV light for 30 to 45 minutes. Disposal and handling of waste materials must be disinfected, labeled, and segregated in proper trash bin. Doffing sequences of PPE are as follows. Remove booties or shoe cover. Remove gown and gloves together. Perform hand hygiene. Remove eye protection. Remove mask or respirator. Remove head cap. And lastly, perform hand hygiene. Remove PPE at doorway before leaving the patient room. Infectious PPE, intended for reuse, such as gowns, goggles, protective eyewear, face shield, and respirator mask, must likewise be placed in a separate bag before disinfection. Remember the dental acronym D. Disinfect hands through hand washing or alcohol. E. Exercise and eat well. N. No unnecessary traveling. T. Truly observe social distancing. A. Always wear mask. L. Look on others' welfare. By immediate comprehension, it will surely greatly affect the number of accomplishments of our dental treatment facilities. To achieve our breakthrough goal is not an easy journey for us, but on our end, we will always do what we can to attain our target despite of environmental circumstances. For core approach perspective, we have elected strategic objective number 13. OTCDS needs to have activities that can appropriately assess the needs of personnel and dental units in order to fill the capability gap of the units based on crafted responsive table of organization and equipment. This strategic objective can be measured by a AFPTR readiness condition level, wherein our target for calendar year 2020 is R3, which is partially mission capable, until we reach R2 by calendar year 2022, which is mission capable, and eventually reach R1, which is fully mission capable as time goes by. We set our target in such manner in order to make our targets doable or achievable, as some factors to increase our readiness conditions involves capital outlay, time and individual personal preferences which are not in our control. As of second quarter of 2020, we have already achieved the R3 readiness condition level. Although our target is R3, we are aiming to reach R2 before the year end if possible, in order to raise our readiness condition one level beyond our target. For the capability perspective, we have elected strategic objective number 9. OTCDS believes that every unit should have officers and civilian dentists with appropriate skills and equipment in order to address the patient's dental problems effectively and efficiently. It can be measured by percentage of cases treated, and our target for this year 2020 is 80%. As of second quarter 2020 review, we have already achieved 91.57%, which is already 11.57% beyond our target of 80% for this year 2020. This was made possible through our recruitment activities, modernization of equipment, improvement of facilities and attending seminars and trainings. For the impact of our breakthrough goals. From the baseline data of 49,702 dentally fit AFP personnel in 2017, truly intense transformation is evident with an increase of 33,161, making it a total of 82,863 on second quarter of 2020. This evident increase is because of AFP Dental Service extra effort on fulfilling its mandate, by getting out in our comfort zone in fixed dental facilities and reaching out on military personnel who are assigned in distant places.
First thrust is to bring dental services as far forward as possible, to ensure timely and inclusive delivery of dental services to our troops.
Natutuwa ang aking kasundaluhan. Natutuwa ako personally na yung mga doctors natin ay pumunta mismo dito sa Mindoro, pumunta hindi lang dito sa brigade headquarters, pati sa mga battalions and companies ko. Maraming salamat.
I have one dental officer in the person of First Lieutenant Michael P. Asanya, Dental Service, who is presently the OIC of the Dental Section Sick Bay of the Civil Amphibious Force, Philippine Fleet, BRP Tarlac LD601. Traditionally, dental officers are performing dental provision at camps, base, forts, and station. However, with the transformation within the Philippine Navy, dental sections were placed at the two LDs of the said force. So currently is providing dental services.
On the core perspective, creation of Dental Service Education and Training Board resulted to 2 dental officers with inclination to oral surgery to be recommended to take the specialization course on oral and maxillofacial surgery class 15 to 20. At the same time, dental problems of military personnel were addressed more effectively and efficiently, and number of recurring dental problems was decreased. For capability perspective, percentage of cases treated were increased from 60% in 2017 to 91.57% in second quarter of 2020. This means number of referrals to other dental units and private practitioners decreased.
Our dentists and dental officers are trained and skilled in various dental specializations. This enables us to provide prime dental service and treatment to our military and civilian personnel.
Okay naman po kanilang service nila. Kompleto naman po kanilang gamit dito at hindi ko na po kailangan pa lumabas pa po.
Technical Working Group. The main key to the continuous implementation and monitoring of the office performance is the Technical Working Group. Thus, the first OTCDS-TR Technical Working Group detail order was created on January 28, 2019, updated on July 5, 2019, and on February 28, 2020 through Office Detail Number 2020-01. Currently, the OTCDS-TR-TWG that drives the office's strategy execution is chaired by Colonel Enrique Pacifico M. Pabio, Dental Service General Staff Corps. As prescribed, the designated AFPTR Action Officer is Major Ryan J. Clariga, Dental Service, Chief, Admin and Personnel Branch, whereas our very own Guild of Civilian Employee is Ms. Cheryl Asindayan, Civilian Human Resource. The other members of the TWG are the branch chiefs and other 8 OTCDS personnel whose memberships are instrumental in having dynamic and productive meetings. The Office of the Chief Dental Service, through the technical working groups, continuously conducted trainings to ensure that all processes, systems and functions of the office are aligned with its performance scorecard, as well as to ensure the continuity and sustainment of the OTCDS transformation roadmap. As an innovation and initiative to cascade office transformation roadmap, this office improved the appearance of its AFPTR corner with strategy map, dashboard and breakthrough goal scoreboard. Another innovation is the conduct of examination to identify all personnel's level of awareness in our transformation journey. This enabled our office to monitor, assess and improve our strategic communication initiatives. Consistent communication. Cascading of our strategies, updates, and new initiatives to major service dental surgeons, AFP Health Service Command, and all dental treatment facilities are constantly done through the Chief Dental Service AFP's guidance during family conferences and monthly coordinating conferences. Aside from regular meetings and conferences inside the office, communication is done through the various materials readily accessible to all personnel. To ensure effective and efficient communication, we have the OTCDS Stratcommon Plan for 2017 to 2022, Horizon 2 Dental, which is regularly monitored through the Stratcom Accomplishment Report quarterly. This is intended to communicate the objectives and transformation desired to key audiences to generate broad understanding, advocacy, alignment and support for OTCDS AFPTR. We facilitated the design, production, and communication materials in quad media for both internal and external audiences. Link to budget. As a rule of thumb, every initiative should have projects, activities and programs which will be enabled by a budget for it to be implemented. With this in our mind, we need to allocate resources to our strategic plans and initiatives. We have established a strategy-driven budget for the previous year, and current year 2020. We have allocated a budget in all our 14 initiatives and synchronized it with our SIP, PMP, and WBS, which is certainly important to the overall success of the scorecard. Monitoring and reporting mechanisms. Technical working group meetings are held every month to update our monitoring tools, which includes monthly strategic initiative progress report, performance scorecard, dashboard and scoreboards, using our strategic initiative profiles, project management plan, and work breakdown schedule, in order to make sure the timely implementation of the activities. Office dashboard is clearly visible to everyone anytime at the AFPTR corner of the office. And branch scoreboards beside the table of each concerned branch, reflecting the monthly and quarterly status of accomplishment of their branches. Commitment of leadership. Since the beginning of our transformation journey, the leaders of the Office of the Chief Dental Service have been giving their all-out support. In all messages and speaking engagements, the Chief Dental Service AFP constantly includes the ideals of transformation in relation to the attainment of our mission and vision. Cascading to lower-level units. More than alignment to the office function and mission, we ensure that the strategy of the scorecard is being cascaded to major service dental surgeons, AFP Health Service Command, and all dental treatment facilities. We encourage them to reflect our scorecard measures to their respective office scorecards. Hence, all activities set in our scorecards are being executed by all dental units, and are being monitored through monthly reports, staff visits and communication to keep everyone abreast, on track, and make sure that our collective efforts are heading towards the same goal. All office branch and personal scoreboards have been constantly updated and monitored. All OTCDS personnel have a personal scorecard containing their plans, measures and targets for 7 facets of life, which are professional, education, physical, social, family, economic, financial, moral, spiritual and environmental. Linked to incentives, rewards, and recognition. In order to motivate our dental officers to strive more, we decided to issue a memorandum to dental treatment facilities stating that this office will give an award to all dental treatment facilities that will reach 90% and above Class 4 dental profile. Based from the resolution submitted by AFPTS Anniversary Awards Committee, 8 out of 47 dental facilities received an award last July 30, 2020 during the AFP Dental Service Awarding Ceremony. Moreover, This office also gave incentives, rewards and recognition to deserving personnel who got the most accomplishments in their individual personal for them to achieve personal goals, which will have great effect in office AFPTR in their balanced life. Best practice identification and sharing. One of the best practices that was identified by the technical working group is the use of mobile dental care system for standard operating procedure. This is contributory to office breakthrough goal number 1 and 3. Through the utilization of mobile dental vehicle, we are able to provide dental services in favor of the AFP troops based in distant places who are deprived of necessary dental services, which hampers the achievement of dental readiness as part of combat effectiveness that enhance the morale of troops. This resulted to decrease on the percentage of unsurveyed military personnel from 37% in 2017 to 18% in second quarter of 2020.
I'm First Lieutenant Virgil Martinez, O-20318, Dental Service, the officer in charge, Dental Section of BRP Davao del Sur, LD602. We are deployed aboard naval vessels in order to extend our dental services to the Philippine Navy personnel aboard ship. Previously, our sailors and Marines have access to dental services only through Philippine Navy dental dispensaries. Through the efforts of the Philippine Navy leadership and the Chief Dental Surgeon Navy, Philippine Navy personnel aboard LDs have ready access to oral health care even during maritime missions. These efforts enhance personnel and operational readiness among sailors and Marines and ensures that our men and women in uniform are always fit to serve.
Another best practice is the career management through creation of Dental Service Education and Training Board per AFP regulation. This is contributory to breakthrough goal number 1 and 2. The purpose of DSETB is to appropriately choose dental officers to undergo schooling on career and specialization courses, both locally and abroad. As a result, an addition of 2 dental officers who were more senior to the 10 dental officers previously recommended who have inclination to oral surgery were recommended to take the specialization course on oral and maxillofacial surgery class 15 to 20. The TWG identified system and recruitment of probationary second lieutenant dental officers. This is contributory to office breakthrough goal number 3. A system was formulated with the following activities to intensify the recruitment activities of major service dental surgeons, which improve the AFP dental service organizational structure and thereby provide faster and more comprehensive dental services in favor of AFP military personnel.
In order to maintain the total strength of dental officers, recruitment efforts were intensified through information drive to different universities and colleges nationwide. This initiative was done in synchrony during the conduct of staff visits to AFP dental treatment facilities. As a result, 7 dentists are programmed to undergo Technical and Administrative Service Military Orientation Course Class 15 2020. 6 dental officers graduated from the Technical and Administrative Service Military Orientation Course Class 14 2019. 13 dental officers were commissioned and ordered to duty last November 23, 2019.
In addition, this office identified another best practice of using info video and infographics, contributory to office breakthrough goal number, which resulted to easier cascading of information to internal and external stakeholders. Last July 20, 2020, for our third quarter family conference, we cascaded the AFP trip to lower units and conducted best practice sharing and well as distribution of our STRATCOM materials. Plans on moving forward. To fully achieve and sustain our transformation, we will address the issues and concerns that arises, especially for the focus perspective that was greatly affected by COVID-19 pandemic. As our action plan, we will extend the days and hours of clinic operation by opening our dental treatment facilities 24/7 and dividing the duty of dental officers into shifts. This aims to cope up with the time spent in disinfection of treatment room and between patients. To address the issue of incapability of treating suspected and confirmed COVID-19 positive patients, we will make a treatment room and select a DTFS dedicated to treat suspected and confirmed COVID-19 positive patients. While this office is translating these into policies, we had also made our initiatives. First, by requesting support to stakeholders for mission-essential dental equipment, necessary during the implementation of the new normal, which resulted to the donation of personal protective equipment and 48 sets of extra-oral vacuum system and air viral machine, all of which were already distributed to our 48 dental treatment facilities. Second, by conducting a webinar last July 30, 2020, with the topic Bounce Back to Dental Practice After COVID-19 Pandemic as discussed by Dr. Ryan de Guzman, dental officers learned the rudiments in making a treatment room capable of treating suspected or even confirmed COVID-19 positive patients. This is through the use of a negative air pressure system. Some dental procedures create aerosols, and there is evidence that these can stay in the air for up to 3 hours. To prevent these aerosols from lingering in one room, or even traveling to the next room, creating a negative air pressure room is recommended. Along with air purifiers, extra-oral vacuums, and HEPA filters, this negative air pressure system continuously removes air from the room, filtering and sterilizing it along the way to ensure that clean air is returned outside of the room. This protects our patients and our dental personnel by creating directional airflow away from the people in the room as air is withdrawn up and away from the work area. Beginning with these first steps of the office, resulted to the adaptation and cascading of this system to various dental treatment facilities. Upon full implementation of this plan, the number of patients that can be accommodated by dental treatment facilities will not be affected, thus continuously increasing our accomplishments. In addition, the Office of the Chief Dental Service will sustain the AFP transformation roadmap mechanism. We will continue to monitor, assess, and evaluate our strategy to maintain our good governance practices. In conclusion, we want to end our presentation with a quote from Henry Ford: "Obstacles are those frightful things you see when you take your eyes off your goal." With that, the Office of the Chief Dental Service will not be moved by adversities. We will be resilient amidst the new normal. We will continually think of ways on how to overcome the challenges of the AFP Dental Service, and instill in our hearts and minds our mantra.
One team, one goal. One team, one goal.
One team, one goal.
One team,
One goal.
one team, one goal.
One team, one goal.
One team, one goal.
One team, one goal.
One team, one goal.
Of one team, one goal, for an excellent and professional AFP Dental Service.